So our first test is going to be the lateral inversion ankle sprain. So me, the examiner, I will have one hand stabilizing the lower leg, and my other hand will cup the heel and invert the ankle, so that way you're turning it inward. And does it hurt when I do that?
Yes.
Okay.
Excruciating pain.
Okay. So the result of that, the talus tilts excessively, and then there's going to be pain produced with that motion on the lateral side right here because I'm pulling from that. So that would indicate on why she's having pain on the lateral side. And since she's feeling pain in that test, that suggests damage to the calcaneofibular ligament. Okay. Next test will be the interior drawer test. Again, one hand stabilizes at the interior lower leg, and the other cups heels with toes, resting on forearm. But this time you'll pull the foot outward. So like you want to kind of keep the lower leg still and just pull on the foot. Does that hurt?
No.
Okay. With that one, the results are like the talus is sliding farther forward than the non-affected side. And if she had felt pain, that may indicate an ATFL sprain or tear. You usually want to do bilateral testing with that. So you test the other side to make sure that they're not feeling pain on like both sides. Okay, next one is the squeeze test. This is a test for fractures. So me, the examiner, you gently press on both sides of the lower leg while athlete's knee sits and extended. So while it's extended out. And then you would like squeeze.
Ouch!
Did that actually hurt you? Okay. Squeeze
Ow!
on
Ouch!
the leg. And you start distal, which means you start at the very top of where the injury would be, because the injury would be lower down on the foot, and then you would squeeze all the way down, and then the result should be pain away from pressure. And with this one, when they're feeling the pain, that suggests that there's like I think that there's like a fracture in one of the metatarsal. I don't remember. I think it's the metatarsal, like where you're pushing on it. Oh, maybe it's your tibia. I don't remember. While you're pulling on it, basically the bone is being pushed out. So it's like it hurts. I don't know how to explain it. Oh my god, it's so dumb. Okay. Next one is the inversion Taylor tilt test. I don't know how to pronounce that. Okay. And then, bend your knee again for me. So my hand would stabilize the lower leg again, and then other one would cup the heel again. But this time you're gonna evert it, so you're gonna push it outwards. So like that way. So instead of going in, you'd go out. It's like the opposite from the inversion test. And did that hurt?
No.
Okay. So with that one, again, the talus tilts excessively, and then the pain produced with motion. So on this one, they would be feeling pain on the medial side of the leg, so like the inner side, because again, you're pulling, basically pulling on the muscles and stuff on that side, like where they're not supposed to, like you're pushing them outward. I don't know how to explain that. Jeez. Shut up, don't judge. And that one would suggest damage to the tibio-calcaneal ligament. Next is the high ankle sprain, also called the wedge test. So, again, my hand would stabilize the lower leg, the other cups the heel and applies force to talus into fibula. So this time when you're doing it, you're like pushing talus into fibula. Yeah. So you're gonna like basically like push up on the foot to shove not shove, but like push the talus into the fibula to see if that hurts. Did that hurt?
No.
Okay. With that, the result should be pain near the syndesmotic joint, which suggests a high ankle sprain, of course. But since she didn't feel pain with that one, she doesn't have that. Cough.
Right.
Kliger's? I think that's pronounced the Kliger's test? Okay. And you only perform the Kliger's test if the wedge test turns out negative, which is the one I just performed. So if that one turns out positive and she had felt pain with that, then you wouldn't need to perform this one. But external rotation force. Okay. So this one, you're still doing the same thing, but you're gonna do additionally internal rotation force. So so external rotation force. I think you would push her for outward and push up again. Did you feel pain with that?
No.
Okay. So with that, the result will be pain in the medial ankle, which may indicate deltoid ligament injury. And then the next test is the for stress fractures. It's called the bump test. And this one, okay, put these straight. Basically, all you have to do is bump the heel with the heel of your hand. So bump their heel on their foot, the calcaneus, with the heel of your own hand. So just kind of like tap it. Does that hurt?
Yes.
Okay. So obviously when I do that, they should feel pain right there. Pain in the calcaneus, talus, or lower leg bones. Exposing possibility of fracture or stress fracture. So since she had felt pain, there's most likely a fracture in, I'm not sure if it's either the tibia, is it your calcaneus? Okay. Next one is the Achilles tendon rupture. It's called the Thompson test. Squeeze the calf should cause plantar flexion of the foot. Do you know what plantar flexion is?
No.
You're gonna take your foot and go like that. Yeah. Okay. Not yet.
Oh.
So okay. So when I squeeze your leg, it should cause you to go into plantar flexion, but I don't know if it really will. So just work with me. Okay. I don't know. I don't remember how to do this one. Oh, we've done all these. Okay.
Right. No.
Okay. So the results will be no plantar flexion or movement in the foot, which means a probable tear. So since, like, if her foot wouldn't have moved, that means like the tendon that controls the movement of the plantar flexion or the dorsiflexion, since it didn't move, that it's possibly torn.
Oh, so I have a torn ligament right now because it didn't work.
Yeah, and that is all the tests for today. So, great.